Namaste. Andriko Namaskaram. Today I am before you again in relation with expected COVID third wave. I wanted to provide few update and what are the actions we are taking at VSGH on behalf of RINL and VSP to protect our employees and their families. As far as the COVID wave 3 is concerned, there's a lot of news in the media about the Omicron virus. So people need not be afraid of this different names, what we call Delta plus Omicron kind of a thing. That is a natural process for any virus to mutate, and when each mutation occurs, it is given a different name as per the international WHO standards. So as far as the Omicron virus is concerned, which was first identified in South Africa almost more than 1 month ago. So till now we didn't have much information about its properties. Now we have enough data, scientific data, suggesting that Omicron virus is not a dangerous virus. It can be more infective. That means it will cause infection in more people compared to Delta plus virus in the second wave. So the infectivity rate may be 3 to 4 times more than the Delta plus, but that doesn't mean that it's going to harm people. It will infect the people, but it is less severe will be the infection, because the virulence of the virus will go down as the virus mutates. It can already mutated more than 30 to 40 times, and it keeps on mutating. And the natural property of the virus is, as it mutates over the years, it loses its virulence or the strength of causing the disease in a person. It can go on infecting, but its severity will go on coming down as the wave passes on. That is the normal way any viral disease will subside and end itself. You might remember 10 years back when the dengue fever started. First 2 to 3 years it was a very severe disease used to occur in the population, and it has killed many people. But now over the 10 to 12 years down the line, now also dengue infects people in the season, on the rainy season when mosquitoes are there, but occasionally any deaths happen. Similarly, this virus is also now, it is in the third wave now, already a lot of mutation occurred, and thereby this virus has already proved it is infective but not virulent. So as per the latest data, I can tell you, based on the South African patient data which is analyzed, when we compare to Delta virus with Omicron, the median age of affecting the population with Delta it was 59, and now Omicron is its age group is at 36. That means Omicron is affecting the younger population compared to Delta plus. So that itself is a blessing in disguise, because younger population will have a good immunity, and mostly they will not have any comorbidity diseases. So the severity of the disease and deaths will be very, very less. So that is one. Second thing, acute respiratory symptoms like severe coughing, breathlessness and all is more commonly seen in Delta. That is almost in 91% of the people who infected, but it is only seen in 31% with Omicron. So again the lung involvement is very less. So thereby again severity will be death, and deaths will be less. And duration of hospitalization, average duration was 7 days for Delta, whereas it is 3 days now for Omicron. So that means when the disease is not severe, patient first of all doesn't need admission. In case if we become mild to moderate infected and gets admitted, you get discharged very early. So only 3 days of average admission is seen in the South African patients. And since I earlier said the lung involvement is less, so based on that the oxygen requirement for the patient will be also less in Omicron. Earlier in Delta second wave, 74% of the patient required oxygen. Now only 17% of the patient will require oxygen in case if they get some mild to severe symptoms. Hospitalization again, almost 70% or 69 to 70% required admission in case of Delta. Now it will be around 40% only requiring admissions in case of Omicron. ICU admission also very less in Omicron, only 18% compared to 30% with Delta. And ventilator requirement is also very, very less here, 12% in Delta and only 1.6% will be with Omicron. because again because it is less severe, it doesn't affect the lung so severely. So that ventilator requirement is also less, similarly oxygen requirement will be also less. And when all other things are, all the symptoms are less, definitely the mortality, the death rate also will be less. It was almost 30% in Delta, 29%. And Omicron, as of now in South Africa experience, we have seen only 3% death. So looking at this scientific data, which is based on the South African experience, definitely we can be rest assured that we may get more people get infected with Omicron because it is more infective, but it is less virulent. So we need not have to worry. But that doesn't mean that we go scot-free and get infected. No, we should not do that. We should stick to all COVID preventive guidelines, using mask, sanitization, and also maintaining the physical distance, not to gather unnecessarily in the parties and other functions, marriages and all that. Just for next 1 month, if we can follow this, we can subside this COVID third wave to a certain extent. But still, this COVID third wave will cause more infections in the people, but we need not have to bother because severity will be less, treatment will not be needed for 70 to 80% of them will be asymptomatic or mildly symptomatic, no treatment required. Only about 20 to 25% will have a mild symptom who may require basic treatment, and maybe 1 to 2% will be severely affected, those who are 60 plus, immunocompromised or comorbid people, and they may require little hospital admission and oxygen administration, such thing. So that way we expect the burden on the health system will be less, and we will be able to manage the third wave better than the second wave. And coming to the symptoms of comparison of symptoms in first wave, second wave and coming third wave, the smell and taste was completely lost in the first wave, but in the second wave there was a complete or a partial loss of sense of smell and taste. But in the third wave you don't get any of such symptom. There will be no loss of smell and taste. So don't expect for that and wait without going for testing. Cough and cold was very common. Dry cough was very common in first wave. Again, dry cough was also common in the second wave with no cold. But in the third wave, mild cough with phlegm and cold also is seen. So if there is a mild cough with productive cough with phlegm and slight cold, then you can expect it is a Omicron infection. And chest congestion, it was very severe in first wave and second wave, and in the third wave it is very, very rare, and if it all happens, very mild congestion or no congestion itself, because the infection will restrict itself to the upper respiratory tract only. Fever was high grade in first wave and second wave, and the third wave will get a very, very mild fever or no fever at all. Weakness again severe in first and second wave. This time you may feel mild weakness or you may not feel any weakness at all. And coming to the respiratory distress, severe in comorbid patients in first wave and severe in many patients second wave. Second wave it was severe among the healthy patients also. And that respiratory distress is very rare or less among in the third wave, because as I told earlier, the respiratory involvement of the virus, lung involvement of the virus is very less. And coming to the hospitalization, it was about 10% patient required hospitalization in first wave, around 12% required hospitalization in second wave, but now in the third wave, less than 1% are expected to be hospitalized. So again, that shows that it is less virulent, and 70 to 80% are asymptomatic and mild symptomatics, and very few are severely symptomatic. So thereby the hospital admission will be less. So after giving this data, this will ensure that we need not get afraid of this third wave, but we should try to prevent as far as possible, because it is spreading fast. So that last wave, if we have 1 lakh cases, this in that place now we will have 4 lakh cases, because it's 3 to 4 times more spreading infective. So that number of patients will be more. So that may create an unnecessary panic among the population and with the governments and health system. So we should try to restrict the number of infection by following these COVID guidelines. So after briefing about the third wave and Omicron, now let us come what VSGH and RINL, Vizag Steel Plant, is doing as a precautionary measures. So already we have conducted 2-3 meetings among all the specialists in the hospital, and also we have created a cross-functional team at the management office of RINL with all the senior executives there, and we have planned an action to prevent the infection and to manage the COVID third wave. So accordingly, we have brought out the surveillance guidelines and also the COVID case management guidelines for RINL VSGH. So as far as the hospital is concerned, from next Monday onward, that is 10th onwards, we will be minimizing our OPD services. We are requesting all the employees and the dependents not to come to OPD with any minor health issues or for repeat medicines or follow-up if it is not required. So for the repeat medicine, we have done a system wherein you can directly go to the registration counter, you can register and go and collect the medicine from the pharmacy. Don't have to come to the OPD and wait in the queue. And about the NA medicines, you can use the Xerox copy of the previous NA slip or the entry made in your medical book, and over that you can purchase the NA medicine for the month of January. And for the COVID management, we are opening a fever clinic and blood collection center and admission all in MBU area, main burns unit area. So entry is from towards the next to the casualty side. So all those people who have fever, suspected COVID or fever, any fever or respiratory tract infection need not come to OPD directly. Please don't enter from the front door of the OPD. You go towards the casualty, and next to casualty there is a MBU entrance is there, main burns unit entrance, where earlier you used to do the COVID test. So you enter from there. There will be doctors, nurses. So doctors will do the examination of you and give medications and advise test if required for RT-PCR test, which you can get it tested in our testing area near the main store on Tuesdays, Thursdays and Saturdays. And also MBU area will also have facility for collection of blood for the COVID positive tested patients who are on treatment to check for the COVID inflammatory markers and other things. And also any requirement of admission, for the time being, we'll start admissions in the MBU, main burns unit ward only, since the number of admissions are very, very less. As of now, we just have 1 or 2 patients there. So majority of the patients don't require any treatment. And if at all they require only symptomatic treatment like a flu treatment, like a crocin with cetirizine and B complex. And the protocol what we have created for management is those patients who are having mild respiratory infections, upper respiratory infection like maybe slight cold, slight throat pain or cough, irritation, slight body pain or slight fever. It could be COVID, Omicron. So nothing to worry. Please start with simple drugs for headache or fever like a crocin or Calpol tablets 2 to 3 times daily depending on the fever. And if there is a cold, you can take a cetirizine tablet, 1 tablet per day, and do hot water, salt water gargling and steam inhalation, and take some B complex tablets and stay at home for a day. And on the testing day, you come. If it happened to be testing day, and that day when you have a symptom, same time you come between 9 to 12. Testing will be done on Tuesday, Thursday, Saturday. Get tested. If testing day happen to be tomorrow, you quarantine yourself. When the symptom comes, you quarantine yourself with the mask on in your house in a separate room. Then next day, the next immediate day for testing, you come and get tested until the test result comes. Usually test result comes on the same day evening. Till then you quarantine yourself. If it is negative, it is not COVID, so it is only upper respiratory infection. Continue the same treatment of cetirizine, Calpol, any flu treatment, and you can wear mask for next another 4-5 days, and then you will be all right. If the test become positive also, you need not worry because symptoms are very less. You don't require any admission. Just consult the doctor once positive comes. Just consult the doctors at the fever clinic, and they will advise you the medications, basic medications for this upper respiratory infection with COVID. Based on that, you will be asked to take medication and quarantine isolate at home for next 3 to 5 days. And usually these symptoms will come down by 3 to 5 days. And in the meantime, you keep monitoring your oxygen level, SpO2, and your temperature and your pulse rate and respiratory rate in this 3 to 5 days at home when you are taking treatment. At any point of time, if you find your oxygen level, SpO2, falling below 95%, or if you think your temperature is crossing 100 to 101 anytime, And if you think your pulse rate is going beyond 90 and 100 above, and if your respiratory rate is going above 24, then you think that the disease is progressing in you. So that time you need to come to our COVID center and consult the physician. So the physicians also will consult all these COVID positive patients. Follow-up will be done at the MBU ward only at a fixed time that we will be announcing most probably between 10 and 11 o'clock in the morning. The physicians will come there into the COVID ward at MBU, and there all the outpatients also will be followed up, those who are tested positive and staying at home. And after checking, the physician will decide whether to admit you or not. If you are improving, all the parameters are normal, they will send back home with the reassurance and medication. If they feel that your progressing disease is not coming down, then they will advise further test, COVID marker test, blood test, which will be collected there only in the MBU ward, and doctor may advise you get admitted in the MBU ward for the time being. And once the test comes, then they can start, then we can need the second line of treatment for COVID, which are injections, basically the injections. So that will be taken care by the physicians. So this is as far as the treatment protocol is concerned. And coming to the surveillance part of it, how we have to be careful is, one, anybody in the house having any symptoms of upper respiratory tract infection, as I said earlier, flu symptoms, they should immediately go for testing. Until the test comes, they should isolate. And if it becomes positive, then all the other contacts in the house, which are called primary contacts, they should be going for testing, COVID testing, to test their status. So based on the test result, again, both the patient and the primary contacts, if they are positive, they will be put on treatment as I advised earlier. And if they are negative, then you need not have to worry. So, and anybody coming from outside the district, outside the state, outside the country to your house, please take them for testing. Till then, you quarantine them in your house in a separate room. Take them for testing on the next opportunity. And once the result comes, then only you take appropriate action. If it is positive, again you have to follow the system what I told earlier. If they are negative, then you will be safe at home. And also you have to declare those guests arriving or children or guests arriving from outside to your house to the VSGH or town administration authorities. And similarly, in case of employees, if any employee found to be having symptom, they should quarantine, inform their zonal HRs or their HODs, quarantine yourself at home, test yourself, and if it is positive, inform your department, HOD or zonal HR, and they will permit you to stay at home with the treatment for 7 days as an isolation, and immediately get your other contacts both at home and at the workplace, your department contacts and your home contacts, primary and secondary contacts, and for testing. So you inform all your contacts, inform your authorities also that who are your primary contacts, so they will go for testing, and if they are found to be positive, and again the same system will be followed, and their primary contacts, that means the secondary contacts of you, will be also tested, and the actions is like that. The chain of tracking and testing goes on. That will help us to cut the chain of infection, so that not many people inside the plant get infected, and that affects the production of the plant. So these are the few steps we have taken. So I would request, don't panic. Anybody in the family, if they are ill, please follow this instruction what I suggested. And also in case of any doubt, we are going to operate a medical call center where a doctor will be managing the call center. So we'll announce that date in the portal and the media. So you can call that doctor in the call center and you can get clarified any clarification you want regarding this COVID in your family. So with this, I would like to assure you that, and coming to the bed availability and oxygen, we are ready with all the drugs, enough beds, oxygen, everything. As of now, we have 100-bed quarantine isolation facility at the hostel 1 available for those who don't have extra rooms at the home to quarantine yourself. If you are non-symptomatic positive or mild or moderate symptomatic positive, you can come and isolate yourself till 5 to 7 days, and we can go back home once you recover. That is only for mild to asymptomatic and mild symptomatic people. And for those who are moderate to severe symptomatic needing admissions, we are ready with another 260 bed with oxygen facility. So we have around 75 beds in our regular wards, all the 4 wards. including 5 wards, including the casualty ward. Plus, we have created another 50-bed facility in our physiotherapy center in case it is required. So, totally we have about 125 beds with oxygen available in the hospital itself. Plus, we have another 200 beds created in the Gurjada Kalakshetra. So, that will be the next facility we have created. And if that is also full, then we have created another 50-bed facility in CWC 2. And we are kept things ready that at a short notice of another week or 10 days, we can increase another 10 beds. So as of now, we have 100 isolation quarantine bed, 260 oxygen beds available, and we are ready to expand to another 100 to 200 beds in a short period of 1 to 2 weeks time. So with all this, we are geared up to help you and your family. Don't panic. I request you again, please avoid attending any ceremonies, any gatherings, any unnecessary traveling, outstation, holidaying, and going to the clubs, parks and markets unnecessarily, at least for the next 2 weeks. This is very crucial. Even government is bringing in partial lockdown kind of a situation, like night curfews, weekend curfews, to avoid these unnecessary movements and gatherings, so that we can control the third wave in the beginning of that third wave itself, so that we will not have large number of patients to be attended to. So if you are not careful in the next 15 days, definitely the cases are going to come in 4 times more than the Delta cases, and that will be a challenge for the health system to handle. So I request to keep yourself and your family and your relatives safe. Don't go out unnecessarily. Please keep the authorities informed, VSGH and VSP plant authority informed in case of any symptoms, any respiratory symptoms in your family or in your workplace or in your colleagues or any friends, and encourage them go for testing and quarantining till the result comes. So with this, I assure you that we are there to safeguard your health, and we are all ready. And I wish all of you a happy new year and take care of your family. Thank you.
Welcome to our YouTube channel. Don't forget to like, subscribe and share the videos.